Hey, I'm Dr. Jeff Ledford, and today we're going to talk a little bit about how we can prepare your patient for surgery. So one thing to always keep in mind is we want our patients to be fasted before they undergo anesthesia. And so we always recommend that our patients not have food the morning of a procedure. So whenever you bring your pet in that morning, go ahead and let them be fasted. You can give them water that morning. And the night before, try to withhold food after 8 p.m. That way, when you get your pet here that morning, we can be sure that we're not going to have any risk as far as aspirating while they're under anesthesia. One thing that we always pride ourselves on in surgery is we try to really go above and beyond for our surgical patients. And so all of our surgical patients are going to be under full anesthetic monitoring, and that's going to include EKG, blood pressure monitoring. They're going to have an IV catheter with intravenous fluids. If that procedure requires inhalant gas anesthesia, they're going to be intubated. We're going to be monitoring end-tidal CO2, pulse oximeter, the full works. Pretty much, if you would expect yourself to have that same monitoring, your pet's going to receive it as well. Prior to surgery, one thing that we also recommend is running pre-anesthetic blood work. We're fortunate to work with a very good laboratory, and so if we know that we have an elective procedure or a procedure that's going to be scheduled, you can come by at your convenience before the surgery. We can draw the blood, send it off to the laboratory, make sure that we're not going to have any unexpected complications under anesthesia. It also ends up being a little bit more inexpensive for us to run surgery beforehand. We do have the capabilities of running lab work here in the clinic. And so if for whatever reason we have a more urgent procedure and the schedule just doesn't allow for us to allot time to send blood work out to the lab, we can do it the morning of the procedure. We want to make sure that you are as comfortable and as prepared going into your pet's procedure as possible. And so this is an open communication, open dialogue. And so if you have any questions or concerns at all, please feel free to call us up here at the clinic, 701-5000. If one of the doctors or technicians that you would prefer to speak with is with a client currently, we are happy to get back with you as soon as possible.